I think if people have had a chance to review it, it may not have been the full 5 minutes. One of the things we forgot to tell you is that there is a time warp associated with this evaluation. And time doesn't pass the same as it does in the rest of the world. So we're going to say that your 5 minutes are concluded for your review. But if we could just take the opportunity now to start our discussion and begin with our prepared comments. And we will start with Marta Levitt from USAID.
Thank you very much. I represent the interagency group that works on country ownership. We've been working on it and sustainability quite a while now. First of all, we'd like to appreciate the IOM's acknowledgement of PEPFAR's efforts and achievements in moving from an emergency response towards a more sustainable country-led response and providing clarity in terms of definitions and critical components. In the sense of beginning to, I think, crystallize some of the ideas and being able to clarify what do we mean when we talk about country ownership. So I don't know how many of you have read the Global Health Initiative paper on country ownership. Okay, so that was a interagency work which included PEPFAR as well as others in trying to define our terminology, etc. However, we have noticed that even the term country ownership may not really be appropriate. So we are working more now using the word sustainability, which makes sense both to in-host country colleagues as well as to the response that we are trying to achieve. And the word transition pushes many buttons, as Deborah mentioned this morning. So we try to stay away from the word transition because to some people, transition means maybe graduation or phasing out or these other very nerve-wracking thoughts. So we try to stay away from the word transition, although we always meant for transition to be a gradual process, moving towards more country-led, more country-managed, and eventually more country-financed response. So basically that is what we mean. And if you read the paper, it might help a little bit, although already the terminology may be changing every day. We have a new term that we try to use to be responsive. We're also very proud of the fact that sustainability has become central to the HIV/AIDS response globally and the leadership role that PEPFAR really has been playing in this global and local dialogue for reorienting programs and activities so they're increasingly led and managed, et cetera, and funded by host countries. Also, we appreciate the acknowledgement that PEPFAR is working in the 4 dimensions. So that was mentioned briefly in the evaluation paper, chapter 10. And we see 4 dimensions, and a lot of this came out of work that has been done previously by many others, but trying to consolidate all the thoughts and also experiences that we initially did in a couple of countries, including South Africa and Botswana, and discussions with Namibia, to come up with what do we mean? What are we trying to achieve? So the first of the 4 dimensions is political commitment and stewardship. The second is institutional and local ownership. The third is capabilities, and the fourth is mutual accountability and financial management. When we talk about looking at how well a country, how sustainable is a country, we're going to try to be able to help measure this eventually across these 4 dimensions, as well as keeping our eye on what I call the ball, which is the health outcomes, as we move towards this more country-led and sustained approach. So with that, we really do agree with the report that this process takes time. It does take time. It takes a lot of thought. There's a lot of complexities associated with this process, this movement, and it is very country-specific. We can't have a cookie-cutter approach. There is not going to be any one plan that's going to fit every country. Each country will have to look at its epidemiological trajectory, as was mentioned in the paper, absolutely. We're going to have to relook at what are we doing? Does it fit the epidemiology as it goes forward? Is there any way we could be more efficient, more strategic in our investments? As part of this process, and then can we actually come up with a well-articulated plan of what we may go forward in the next 5 years or so? We haven't come up with a guidance yet. We're trying to work on it, and I think we're being very sensitive, and that's why it hasn't come out yet. We're trying to assure that what we are putting forward does no harm, as Deborah mentioned this morning, and at the same time is useful to the countries as they work on a coordinated and joint plan with their host country partners. Oh boy. So already, this is just my introduction. So the recommendations, there are two sets of recommendations. One is about it's about, let's see, develop a comprehensive plan for long-term capacity building in partner countries. So one of the 4 areas, dimensions of what we call sustainability now, is capacities. And that includes capacities for workforce capacity, it includes local institutional capacity, which includes the government, private sector, civil society, academia, and it also includes systems, health systems. So for those of you that were in the group before, a lot of this applies. So for us, the framework of sustainability is kind of overarching. It encompasses capacity building, health system strengthening, service delivery, and shifting from service delivery to a more technical assistance approach as countries become more adept at responding. So that's why you'll hear repetitiveness. They're not one thing or another. They are interrelated. And so I think that I'm moved to the second one. I mean, I have other comments. We can always go back to those. The second one is that the complexity associated with planning for implementing measures that foster sustainability and is sorry. The recommendation is building on partnership framework, implementation process. PEPFAR should continue to work with partner country governments and other key stakeholders to plan for sustainable management of the response. We absolutely agree with this. And as I've been traveling around, I've noticed that some countries have taken this initiative on themselves. They have their own sustainability committees and groups that we are part of. They have a plan that they've developed, and so we are also, and those other countries may not. So we do want to have some kind of a guidance for countries to come up with a plan. It should be jointly developed, and we should be able to work together on measuring that progress in each country. And as we said, if we can help countries get to a tipping point, we talked about the tipping point, oops, I'm finished. Okay, then we hope that it'll be more sustainable. So I think the last point is that we want to help the countries get to a place where their response is affordable, efficient, effective, and measurable, that they can continue measuring. Thank you.
Thank you, and we will have time to come back for comments. We'd like to now hear from Thomas from the National AIDS Committee in Malawi.
Thank you very much. Let me start by thanking IOM for the report on the PEPFAR evaluation, which addresses the issue of sustainability, which of course is an important aspect of the national HIV response in many developing countries. The issue of sustainability is also in line with the current African Union roadmap on shared responsibility and global solidarity for AIDS, TB, and malaria. Among other things, this roadmap calls for sustainability on the issues of financing, access to medicines, and also enhanced governance. Let me hasten to say that most of the countries in sub-Saharan Africa are dependent on external funding. Malawi, where I come from, actually more than 90% of our resources for the national response are coming from external resources. So this creates the issue of fragility in terms of the response itself. So the government is trying to build in some resilience mechanisms in the response, and I'm pleased to note that even in the report itself, the issue of sustainability is not looked at as if we are dealing with the issue of self-sufficiency. It just means that as countries, we are able to continue to deliver the required services that we need for the national response. I, just like my previous speaker, I agree with the recommendations that are coming out of the report. And maybe what I can add is that as a country in Malawi, while understanding that ownership of the response is a matter of degree, but I must say that in Malawi, the government is owning the response. The president herself is the minister responsible for HIV and AIDS. And she has also created a department within her office called the Department of HIV and Nutrition. But also there's this National AIDS Commission, which I have the pleasure to head. The National AIDS Commission is basically there to lead the multi-sectoral response. So in terms of having the key processes that can lead to ownership, I think the government of Malawi has tried to do that. I think while we rely on external partners, I think governments have got also a role to play in addressing the issue of sustainability. The first one is to make sure that the costs of the response do not increase. That is, we need to make sure that, like in Malawi, we are registering 50,000 new infections every year. So we have to close that tap. Secondly, is also to deal with the issue of reducing the cost of the response by making sure that we go for cost-effective interventions. And of course, we want to actually generate more domestic resources. I think coming back to OGAC, I think I have just 3 issues that I want to quickly highlight. The first one is the need to build the capacity of PEPFAR country offices, because we also need to have that capacity in the countries. The second one is to find ways of strengthening engagement with multilateral institutions and civil society organizations to accelerate progress towards country ownership. And lastly, of course, we need to know once we have reached our target, and that is we need to put in place mechanisms of measuring ownership. Thank you very much.
Thank you very much. If we can now hear from Desiree from Artisan Direct Support in Guyana.
Thank you. And just to say it's Guyana, because a lot of people think we're Ghana. When we say Guyana, they say Ghana. So it's Guy, as in Guyana. Thank you. Thank you, Kimberly.
Welcome from Guyana.
Thank you. I'm just going to say a little bit about sustainability and transition in Guyana, and talk a little bit about our concerns in that area, and then I have a little question at the end of it all. So I just wanted to say congratulations for the report. I think it's really, really wonderful. And thanks to PEPFAR, PEPFAR started, well, USAID started the response in Ghana for HIV and AIDS, and then PEPFAR eventually came in. And so it has always been a civil society response, mainly. And now we're talking transitioning, we're talking government. So it's a little concern for civil society in our country. For the last 5 years, PEPFAR started talking sustainability, but not in terms of helping us to sustain ourselves, but in terms of letting us come up with plans on how we will sustain ourselves. We needed help in that area. It was not easy for us. All the civil society organizations are not all at the same level. And so even though some people can look at how they can sustain themselves, there are some who needed help. How can we do it? And we didn't get that. They just said the funding is going to go, start looking at how you can sustain yourself. And even though it was said from the representative from USA that transition is not getting rid of, it really did do some getting rid of, because we had 20 civil society organizations under the PEPFAR project, and now we only have 7. So if that is transitioning and sustainability, well then I don't know if it doesn't mean getting rid of. And but even in the PEPFAR program, they started having a project advisory board, and a minister of health was the chairperson of that project advisory board. So even though it was a project funded by PEPFAR, the Minister of Health himself was the head of the board, and therefore there was some collaboration between government and the civil society. Albeit where civil society organizations were reporting to government as to their activities, it was not done in the opposite way, where government was reporting to civil society. So for me, I didn't think it was that real collaboration, kind of, maybe it was kind of one-sided. Most of the money, like Malawi, that goes to the address HIV in our country comes from external funding, whether it be World Bank, Global Fund, or PEPFAR. The Global Fund did not really support or give money to civil society to implement programs. It was mostly done by the national program. It is only in the last proposal that was just sent in that civil society, at least 4 of them, became subrecipients, but it's in the proposal. It's not been approved as yet. But we were able to get there. I sit on the CCM representing civil society. I'm the vice chair. And so we were able to get them to agree to have a PR and 4 subrecipients for the first time. We don't know if it will get approved, but it still works towards transitioning. PEPFAR has a transitioning program, which I sit on, a committee which I sit on as well, talking about how government can absorb the project started by PEPFAR. I don't know that they can. The adolescent program has gone. People were just sent off on the Ministry of Health in our country with the adolescent program. PEPFAR is not supporting in-school programs in our country, and so they said the Ministry of Health, Education must take ownership for that. And so I don't know how they're going to be able to absorb more when they are now themselves getting rid of some. And we are still concerned about government ownership. Government does some support for civil society in terms of condoms and test kits and that kind of thing, but it's not a lot. We are mainly concerned about the key populations at high risk. One of the things that I have spoken at the transition meeting is that if we don't get funding from PEPFAR, we might have to switch our focus and not work with the most at risk, because it's against the law in our country. And so the business community will not support it. And so we need the support in order to do that. And if we don't get it, then we will not be able to address the key populations at high risk. I just wanted to say that. So I wanted to ask then, how can PEPFAR assist in that area? Because it has to do with the law, and I don't know how much can be done, but we need a lot of assistance in that area where transition is concerned, as well. We will continue to do work with the key populations high risk, which includes MSM, CSW, loggers and miners in our country, and adjacent populations. Thank you.
Thank you very much. I see Daniel sitting here in the front, so I'm sure that there are going to be some questions to revisit your concerns and some discussion. If we could hear from John now, from Apt Associates.
Thank you. Just let me start just very briefly by congratulating the committee on a tremendous amount of work, both in documenting the historical perspective around sustainability, beginning back with the Abuja Declaration all the way through the second reauthorization, as well as many of the country efforts and particularly OGAC and PEPFAR-led efforts, particularly the most recent one that was clearly described based on McKinsey's input. I thought that this was a very strong chapter in terms of some of the theoretical constructs that are very important to think about in terms of transitioning, maybe not transitioning, sustainability. That'll be hard. But I think, which was raised earlier, there's a challenge with the more pragmatic elements of it. And I would just like to point out a few of those points that I found within the context of some of what was related, particularly relative to the 2 specific recommendations. The first, the comprehensive plan for long-term capacity building, and then the comprehensive country-specific planning process, both of which I think are very strong and I would strongly recommend. But again, I think the implementation of those are going to be very important. Let me just also say that we just finished our session on health system strengthening, and I would say that what we discussed in that activity clearly links with this country ownership discussion, and I wish I could pull that discussion into this discussion, but I think that there are some very real and important links there, and I would not want to lose those, but obviously we can't report those. But also the other point that comes out clear in this report is the importance of OGAC and OGAC leadership. And I think that is something that, although it didn't come out as strongly in some ways in the recommendations as I think they may need to be, I think the current administrative management and organization of the execution of PEPFAR may in fact be an important factor in looking at how country ownership is actually transitioned or sustained over time. So many of those points are already covered. Let me just raise two specific points. One is the issue of capacity building. I think that one of the things that I certainly have seen in much of my work within a number of countries is the different levels of capacity building that are necessary. And if I could just use the basic pyramid of capacity building hierarchy, the most fundamental is building the systems and the structures and the processes. Above that, you build then the human resources to execute activities. You build upon that the skills, and then you give them the tools. I think in many countries, the structural system capacity needs are very deep and are very significant. And I think that we still have to better understand how to address some of these deeply profound structural needs of some countries, which are extraordinarily costly and have implications for not only HIV but all health services. And I just wanted to point that out, but also to the extent that these are not just Ministry of Health problems, these are Ministry of Finance, public service, education, and other sectors. And in looking at capacity building in these deep structural environments, I think it takes a broader view beyond just the Ministry of Health. There are examples, I think, where we have been successful. Some of those are expressed here. Some of them are some new things that we've been doing that I think it's important for PEPFAR when it identifies ways of breaking through some of these barriers. It develops a way of disseminating that information and using that information to roll back into its policies and programmatic activities. And I think one example is the MEPI and NEPI program, which I think is doing some of that very profoundly in the human resource field that I'm involved in. The second area is in the area of, as you described, a comprehensive country-specific planning. I actually think this is probably one of the most important recommendations of this section for countries, is that it's essential that we look at population needs, particularly the priority needs of populations. We identify those gaps, setting priorities. We cost those budgets. We understand the envelopes that we're functioning in, and then we go through a resource mobilization process to identify what can be sorted by countries and what cannot be. I'd like to speak more specifically on that, but I just saw the red card, so I'm not going to talk more about it. But regardless, I also have some questions for the team at some point if questions are allowed. Thank you.
Thank you. And certainly we're going to have questions, and please include yourself in that team response. But I see lots of different perspectives even among the participants in the room, so it'll be really interesting. Before I open it up for questions, I would like to ask, in this order, Dr. Black, Dr. Bassett, and Dr. Cates, whether you all have any opening comments that you would like to make about this topic.
I think I will defer because I'm sure there'll be good discussion, so I don't think I'll open with anything.
Well, the chair is deferred. I had one small comment that I wanted to make because everyone, I think, will come back to it takes time. And I think that that's heartening for people who are concerned that country ownership means you're on your own. But also maybe a little bit buried in the report is that in the process of taking time and investing in institutions as well as individual capacity, that there may be a shift in the hitting the targets, that this shift in priorities for PEPFAR may also have an impact on its measurement of its effect, and I think that's an important one also to keep in mind.
Thank you.
I was also rereading the chapter before this, and one of the things that struck me in reading it now is that there's a whole section on diplomacy and the role of ambassadors and chief of missions as diplomatic agents, which in a lot of ways is where the sort of current global health diplomacy office and idea came from PEPFAR. So I encourage people to read that, but it really is about how when PEPFAR launched and invested lots of resources at the country level, including funds that ambassadors had control of, as you know, to make a difference. The knowledge level of ambassadors around HIV increased significantly, and their sense of themselves as understanding the importance of health, which we documented in talking to many people on the ground. So I just wanted to mention that because it connects to the leadership point.